Greetings and welcome to all of our students, our staff members, all of our off-campus partners, repeat visitors, and to our many new guests. To UWIHARP SHAZ Sexual Health Podcast Series. My name is Kelia Anderson, the project officer here with UWIHARP, and I will be your moderator for today's session. Just to give you a brief overview of who UWIHARP is and what we do here, UWIHARP is the HIV Sexual and Health Unit here at the University of the West Indies HIV Cave campus, and we seek to positively influence the sexual and reproductive health and wellness of the university population and the wider Caribbean society. Our primary focus is the development of sexual health literacy among the community through programs such as these, our UWIHARP SHAZ podcast series. You can also take a look at our Facebook pages, our Instagram pages, and you can see many of the other projects that we offer here with our partners such as the Student Health Clinic. Today, we will be having a very real talk about the effects of substance use on the male reproductive system with Dr. Kadisha Douglin. And we know that substance use not only affects men, but it affects men and women. But today our focus will be primarily on the male reproductive system and how it affects it, how we can kind of remedy those situations and, just have a candid conversation about the effects and how it affects the body. So just to give you a little background of Dr. Douglin and, her field, and to just let you know that she's very expert in this field. And you can also send in your questions to us. Let us know if you have any questions or reach out to your general practitioner if you have any concerns that may come up during this conversation. Dr. Douglin is a general adult psychiatrist. She's a wife and a mother of two, and she's a fitness enthusiast. She completed her Bachelor of Medicine, Bachelor in Surgery at the University of the West Indies in the year 2008 with a special recognition for her performance in psychiatry. She successfully completed her postgraduate training in general psychiatry at the University of the West Indies Cape campus and was awarded her doctorate of medicine in psychiatry in 2017. She previously worked at the Psychiatric Hospital here in Barbados for 9.5 years and has done various lectures to medical students, union members, and community groups on the topics of stress, coping, and work life. So we can see she's very versed. Dr. Douglin has recently completed a fellowship program in cognitive behavioral therapy at the University of Toronto and is eager to practice, teach, and promote the benefits of cognitive behavioral therapy and mindfulness techniques. We've all been hearing a lot about this because, mental health is very important. Dr. Douglin has a passion for mental health education and promotion and believes strongly that there is no health without mental health. So we will see how this plays into today's conversation and how this can help, remedy the situations that may come up. So Dr. Douglin, welcome to our UWIHARP SHAZ program. And we can just get straight into the conversation. We're going to be talking a bit about what we know to be the male reproductive system. What is substance use? Some people may think of it as only alcohol, but we know there are other substances that can be used and categorized as on the negative side as substance use, the effects of it, if it affects differently across many age groups and those types of things. So over to you, Dr. Douglin, as we have this very candid conversation on substance use and the male reproductive system.
Well, thanks for having me. And I'm glad that this topic is getting a little spotlight. Women's reproductive health has been in the media a lot with what's going on in the US with abortion laws and so on. And male reproductive and sexual health is a really important topic. And it has relevance to mental health because reproductive and sexual health has both physiological as well as psychological components. And we know that psychological factors impact male reproductive and sexual health, and there's kind of this bi-directional kind of relationship.
Yes.
And as a psychiatrist, I will see males with depression and anxiety disorders who have sexual dysfunction,
Mhm.
and males who have sexual dysfunction who develop depression and anxiety as a result. So reproductive and sexual health for men is really important to their sense of well-being, their identity, and their overall health.
Yes.
So,
question before you move on, how do you find that, yes, they're interrelated, but how do you remedy that situation? I know I'm jumping ahead, but because you say that, it kind of give a spotlight to, you know, the many issues that are happening now. And as you rightly say, we only focus in on women or even girls, and how we kind of treat those kind of situations. Do you find that there are enough programs offered, or is there safe spaces for them to go? Do they have enough, you know, NGOs out there really supporting and rooting for men? You know, I mean, I don't hear it, but I'm from where you sit.
I have to say, yeah, I don't think we have enough resources for men. And I think, you know, men's mental health needs a spotlight being shown on it. There's a lot of literature showing that men are less likely for healthcare in general to seek healthcare, to get screening, to present when they have a problem. We know for years that that is the case. And I think if we could have some more comprehensive educational programs, starting from in schools, educating boys about their overall health, their mental health, their sexual and reproductive health. And then, as you said, have safe spaces for men. So in Barbados, I am not aware of too many. I know of one particular group, the Men's Empowerment Group, but I'm not aware of, too many. And I think men do need to be able to have a space where they can meet with other men who are going through similar things and discuss what is happening. Men who found solutions, who can help, you know. So we do need more of that, and perhaps this little podcast can a little impetus.
I'm hoping that it does. Thank you. So you can go ahead as we start, you know, to really give some flesh to this topic.
So, well, I guess I could start with what is reproductive health. So the WHO defines it fairly well. It's a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity in all matters relating to reproductive health and its functions and processes. Reproductive health implies that people are able to have a satisfying and safe sex life, and that they have the ability or capability to reproduce and the freedom to decide if, when, and how to do so. And this is relevant for both men and women. So male reproductive health refers to the healthy functioning of both internal and external male reproductive organs, the endocrine or hormonal systems that regulate those organs and reproductive function. And so we often think that men, you know, remain virile or fertile all their life. And we do have evidence that men can maintain good sexual and reproductive health up until their 70s. But from around age 30, there is an annual decline in testosterone production. And as we'll see, there are a lot of lifestyle factors that enhance that decline or hasten that decline. And substance use is a significant one of those factors.
And we know in the Caribbean, we love to promote alcohol. Well, we call it social drinking and alignment and all the. So we know that is a big challenge here in the Caribbean, worldwide.
And consistently in the literature, you will find that men are more likely to engage in substance use than women. And we see in the advertising, the marketing to men, there's this association with it. If you have this particular drink in your hand, you'll leave the club with this attractive woman, you know? There's this kind of push that using substances makes you more masculine and will somehow enhance your sexual and reproductive function when it's actually not so. So let me just really quickly go over what these organs that make a reproductive system are, and I'll try not to be too technical.
No problem.
So I mentioned external and internal. So the external, we all know, would be the penis, the scrotum, which is the thick skin sac that contains the two testicles or testes. And then the internal would be, there's a tube that collects sperm from the testes that connects to another tube. So that's the epididymis and vas deferens, and the prostate. And so the vas deferens and the prostate play a role in making semen, which is the protective fluid that surrounds the sperm. And then you have the seminal vesicles, which also produce semen. And then you have the urethra, so this little opening at the top of the glans penis, which allows for semen to be ejaculated out. And it also plays a role in urinary function. It connects to the bladder, allows for urine and waste products by the urine to be excreted. So those are the organs. And essentially these organs are gonna produce, maintain, transport your sperm and your semen, and discharge the sperm and semen into the female so that reproduction can take place. And these organs also produce sex hormones, testosterone, right? So I have a little image. Can I share?
You should be able to.
Okay. Oops. Okay, so just a little image showing the organs, right? So the testicle, this coiled tube is the epididymis that connects to the vas deferens, connects to the seminal vesicle, the prostate, and the urethra is here. And what happens with the urethra, because it transports both semen and sperm and urine, when there's ejaculation, there's a little muscle at the base of the bladder that kind of closes off and therefore prevents retrograde or reverse of the flow of the semen and sperm into the bladder. So it goes into the female where it's intended to go.
Yeah.
Right? All right, so I'm gonna stop share.
Sure.
So, the function of those organs is kind of regulated by hormones in your body or your body's endocrine system. And that is a fairly extensive system, your endocrine system, that begins in your brain, with a part of your brain called your hypothalamus, which stimulates a little gland at the base of your brain called your pituitary to secrete hormones that then stimulate your testes to make testosterone and begin the process of making sperm.
Okay.
Right? So problems with your reproductive health can occur with that hormonal regulation system. It can occur with any problems with the external genitalia as well as internal organs.
Okay.
And when we begin to talk about the substances and how substance use can impact, bear in mind, brain, hormones, organs, and substances can have impacts on all three of those areas.
I was going to ask if by chance, if the brain doesn't get that signal, is that what then leads to the dysfunction, or is it a play with something else? Does it have to do with the hormone being released that causes the dysfunction, or does it have to do with all the other factors as well?
So there's usually multiple factors involved.
Okay.
But when it comes to the hormonal system, with the endocrine system, we always have what's called a negative feedback loop. So let's go through that again. So you have your hypothalamus, which secretes a chemical that tells your pituitary to secrete these two particular hormones. One is called LH, or luteinizing hormone. One is FSH, or follicle stimulating hormone. Don't necessarily need to know the terms.
Well, they're elementary, so I kind of know the names.
So LH stimulates special cells in the testes called Leydig cells to make testosterone. And FSH stimulates Sertoli cells to start making the sperm. Now, when testosterone is made, then there's a negative feedback. So there's, let's call it a signal going back to your hypothalamus saying we have enough testosterone, so we could kind of dampen down on this stimulation of the pituitary and so on. Okay. And so that loop helps to maintain balance, or what we call homeostasis. Okay. And if there's any disruption at any part of this loop, either the forward signaling or the negative feedback signaling, then you can have disruption in how these hormones are produced, and therefore how reproductive function is regulated. Okay, understood. Okay. So sexual function is an important part of your reproductive system, right? So you can have everything going right. You can be producing the right amount of testosterone. Your sperm is being made normally so that it function normally, but then you have to be able to have the act of sex. And that is, there's four kind of components there. So there's the mental component, right? Your interest, your desire. There's the arousal, which includes achieving and maintaining an erection. Then there's the ejaculation. And there's also a pleasure component. And if you think evolutionarily, this is something that you need to do in order to procreate and make more of your kind, it should be pleasurable, and it should be something that you remember to do, right? Something that becomes salient. So, so these are kind of four components. Yes. And I think this is where you will see the psychiatrist or mental health professional coming in with regards to sexual dysfunction. So there can be loss of interest or desire for many reasons. Many of them can be psychosocial stressors, substances as well. Then in terms of arousal, achieving and maintaining an erection, that's controlled by the relaxed arm of your autonomic nervous system. This is a part of your nervous system, and it has two arms. Yes. One deals with alertness and fight or flight, and one deals with calm, relaxed digestion, and sexual arousal as well. However, the ejaculation side is stimulated by the active or sympathetic arm. So it's kind of, if you have problems with the autonomic nervous system, you can also have problems with achieving an erection and achieving ejaculation. And alcohol, we'll get to that, but alcohol impairs the autonomic nervous system. So that's the sexual function side of it. Yes. So I think that kind of covers, you know, this is what the reproductive system is, and this is how it functions. Any questions before I? You can continue. I'll put my hand up if anything else comes up. So So like before we go into substances, let me just say that there are many problems that can impact male sexual and reproductive health. We mentioned the hormonal disruption,
Yes.
Sexually transmitted infections, malignancy or cancer, substance use, but also prescribed medications or drugs can have impact. And then lifestyle diseases, what we heard a lot about those throughout the pandemic, these comorbidities,
Diabetes and hypertension.
Diabetes, hypertension, obesity, these can impact sexual and reproductive function.
Okay, yeah.
So through a number of different mechanisms, and that's not what we're here to talk about. And then obviously trauma or injury,
Yes.
mechanical injury, right? So what do I mean when I say substance use disorder? So the Diagnostic and Statistical Manual for Mental Health Disorders, kind of the Bible that we use for diagnosing mental health problems, refers to a maladaptive or kind of not helpful pattern of substance use that leads to significant impairment or distress, and is typically manifested by recurrent use of a substance in situations that cause physical danger to the person using it, or that cause obvious impairment in work or school or social functioning, or that result in legal problems, or that result in social interpersonal problems. So they clearly tell you what this maladaptive part means.
Yes.
Right? So it's not, I have a glass of wine every night, but I otherwise go to work, school, have a good relationship with the people around me. It is clearly that the use of this substance is impacting my physical health, or putting me in dangerous situations, or getting me into trouble, or preventing me from functioning.
Working, yes.
Yeah. So, and the term disorder actually covers a range. So you can have mild, where you may only have 2 of the criteria that are listed in the DSM.
Yes.
And then you can have severe, which is like 6 or more of the criteria.
Okay. So you have the...
So there's always a range of kind of the impairment or dysfunction that occurs as a result of this kind of substance.
Okay, so then this helps to measure the level at where they're at. Then you can then administer right treatment and so on.
Yeah,
okay.
Yeah, definitely.
Yeah.
And there are 2 terms I'm going to define, what intoxication refers to and what withdrawal refers to, because these terms come up in substance use all the time. So intoxication refers to the development of behavioral and psychological changes as part of a reversible kind of syndrome, which is usually specific to the substance you're using, that's caused by the use of it. So with alcohol, we kind of all know what alcohol intoxication looks like. So there's this impairment in your thinking, in coordination, in motor function, changes in mood, and all of these occur as a result of use. Yes. Now, withdrawal is, again, a specific constellation of symptoms or a syndrome that occurs with stopping or suddenly cutting back on the amount of the use of the substance. And it usually occurs after a person has been using the substance for a prolonged period of time.
Okay.
So it's not like, you know, I drink a glass of wine every night, just one, and then I stop and I develop a withdrawal type of syndrome. So it's usually prolonged and heavier use, and then there's sudden stopping and you develop these symptoms.
Okay.
Right? And then in terms of substance use disorder, the other thing we hear about is tolerance, which is needing to use more and more of the substance to get the same or the desired effect.
Yeah.
Or when you use the same amount, you're having a diminished kind of effect.
Okay.
So before, 2 would make me start to notice changes, but now I have to take 4 to feel a little buzz, or, you know. But you understand.
I guess you just meant to call the drink, but because it's associated with the brand.
So it's really, yeah, so I need to take more of this in order to get this same kind of pleasurable feeling that I'm looking
more of a
for.
Dependence or
so tolerance then can lead to dependence as well. And dependence involves a psychological component as well as physiological. So, and you see withdrawal in those individuals who have dependence.
Okay.
So they've been using it for a long time to achieve a particular effect. And then when they suddenly stop or reduce use, they don't get that effect. And that can lead to that kind of constellation of symptoms that we associate with withdrawal from a substance. Right. The other thing with substance use, and I'm going to kind of run through some of the symptom criteria.
Okay.
So individuals often have a desire to or have made unsuccessful attempts to reduce or control the use. They engage in lots of time spent in activities, acquiring the substance or using it, or recovering from the effect it has had on them while using it. And they have strong desire or craving for the substance. And then I mentioned continued use of the substance despite problems in various areas of functioning. And giving up of activities, this is a form of impairment as well. Giving up of activities in terms of work and recreation and social functioning because of the substance use. Whether it's because those activities get in the way of you getting the substance or using it or recovering from it, right? So those are some of the other criteria associated with substance use disorder.
Okay.
And as I said, there's a range. So one person may only have 2 of these criteria, and they may meet criteria for mild substance use disorder, whereas someone who has a severe substance use disorder may check all the boxes, right?
Yes.
And what I would say is, if any of that resonates with anyone listening, your primary care provider really should be the first port of call. And we'll talk about that at the end, seeking help as well.
Yes.
So what are the substances that we're talking about? So I mentioned alcohol.
Yes.
There's also nicotine, there's cannabis. Caffeine is also listed as a substance.
Wow.
And caffeine is a drug, and you can be diagnosed with a caffeine use disorder, and you can have caffeine withdrawal. And I think for anyone who has used caffeine to help with studying and then tried to cut down and experience headaches or shakiness, that's caffeine withdrawal, right? However, in this context, there's no evidence to suggest that caffeine has a direct impact on sexual or reproductive health.
Okay.
Then there are the stimulants. So you might think cocaine, amphetamines, methamphetamines, those kind of drugs. And there are sedatives, hypnotic drugs, like which are usually prescribed like benzodiazepines, opioids, and drugs with a hallucinogenic effect like PCP, LSD.
Okay.
For the purposes of the Caribbean, I thought it would be useful if we mainly talk about alcohol, nicotine, and cannabis.
Sure.
So
because those are the main ones that are
those are the
heavily
main
used.
that are used in our context,
Yes.
right? And a word about cannabis. So cannabis is quickly becoming the most widely used substance worldwide. And if you look at the CCAD, which is the Organization of American States, their Inter-American Drug Abuse Commission, they have reports on substance use in the region. And cannabis use is, in our region, is higher than in other parts of the world. And cannabis use actually starts from quite a young age as well.
Yes, I know the NPSA did some research a couple of years ago. Not sure if they had a chance to reevaluate and so on, but we do find that young boys, young children, should I say, are introduced to drugs at a very, very young age.
Yeah. And what I find, this is anecdotal, but from talking to patients and relatives of patients, cannabis use often goes along with tobacco use in the Caribbean, where they mix tobacco with the cannabis in the wrapper to kind of stretch the cannabis. And that is significant when we talk about reproductive and sexual health, because nicotine, we know for sure, the evidence has been there for many years about the impacts of nicotine on every aspect of male reproductive health. So I will be focusing on those three mainly. And if you have any questions, just let me know.
Sure, go right ahead.
So how should we do this? Should we look at each drug at a time? I think that might be.
Yes, so that we don't confuse the audience. We're clearing information that we're sharing. Maybe we can just go through it one by one. We have about 15 minutes, so let's see how much we can share in that space of time.
Yeah, so in terms of alcohol use, so let me just be clear. So the UK recommends 14 units or less. So think for men, 2 drinks a day, for women, 1 drink a day. That's the recommendation, okay? So right away, what are your thoughts about use in the Caribbean? It's quite high, right? It's quite
it surpasses for sure those 2 or that 1.
And so we also have a kind of a culture of binge drinking. So in a sitting, like on a weekend or at a party, drinking 5 or more drinks in one sitting. That's what
is a happy hour.
Yeah, that's the definition of binge drinking, right? And so while binge drinking isn't the same as alcohol use disorder, it is still problematic and it's still associated with harm. And so in terms of what it does to your body, we know alcohol impacts every organ system. And in male reproductive health, like I mentioned before, there's impacts on endocrine function, so how the hormones are regulating the reproductive system. It disrupts arousal, so that ability to achieve an erection and maintain an erection. It impairs judgment and decision-making, so that you may be less likely to use barrier methods of contraception or engage in condomless sex, which increases your risk for sexually transmitted infections. And then in the long term, with let's say heavier use, long-term use, there's the impact on the liver, and the liver plays a significant role in production of hormones and also in terms of antioxidant system of the body,
Yeah.
right? So the ability to clear products, reactive oxygen species that cause damage in tissue. And it impairs the cardiovascular system. And so you require, your penis needs blood to become erect.
Mm-hmm.
So it needs blood vessels that are functioning well to achieve an erection. So if your heart
is that
yeah.
some people drink or associate being macho whatever with drinking in order to get a girl in the party.
Mm-hmm, mm-hmm.
But then when you engage in all this drinking, it's like your body probably can't allow you to enjoy a good time at the end because you're so intoxicated, or your mental capacity is not there, whatever. So the engagement, as you say, is very risky and it leaves both parties at a disadvantage. So it's quite, the two just don't correlate, but somehow people try to mash the two.
Yeah. And I guess, with the first drink or the second drink, because you're feeling good, you have a sense of euphoria. The judgment is not where it was before, so you're not quite inhibited. So you feel like putting yourself out there and so on. You feel aroused, like you have the desire. So with the first few drinks, okay, well, that's how we're feeling, but then we keep drinking and disrupt function. And so that's in terms of the whole kind of system. But in terms of fertility as well, alcohol, both acute and chronic exposure, decrease testosterone levels. And testosterone, that negative feedback loop. So if you have less testosterone, you would think that your brain would stimulate more testosterone, but alcohol also affects that stimulation. So it's a top-down kind of disruption that occurs, right? And then I mentioned oxidation. Alcohol produces reactive oxidative species, which cause damage to tissues. And the testicles are particularly sensitive to these kind of products that are produced by the metabolization of alcohol. So they damage your body's ability to make testosterone and make sperm. And that's with more chronic use. So alcohol affects reproductive health at every kind of level, right? And then alcohol is a depressant. And we know alcohol is associated with changes in mood, with depression, which can then impact libido and your ability to get an orgasm. So, and then alcohol increases risk of cancers, specifically prostate cancer. So there's not much evidence that it increases risk of testicular cancer, but prostate cancer. So nicotine now. So we've heard there's a wealth of research on alcohol, and anyone can research that. Nicotine also has significant impacts on reproductive and sexual health and overall health. So I did find there was a Barbados Health of Nations study. I think it's available as an open access article on the BMJ from 2015. And it showed that tobacco prevalence was 20.8% in males aged 25 to 44. And then prevalence reduces as you get into the older age groups. But generally in our region, nicotine use is not as prevalent as, say, North America and other parts of the world. But as I told you, anecdotally, I know patients mix the two drugs, cannabis and tobacco. So nicotine by itself, without smoking, because we often think the problem is the smoking and the carcinogens in the cigarettes and the wrapper and so on. But nicotine itself causes blood vessels to constrict or tighten. Imagine a tube that's like this. So the ability of blood to get to the penis to allow for erection and so on is impaired. And then nicotine and the metabolites produced when your body breaks it down is toxic and impacts your body's ability to make sperm and also to make testosterone. So again, those reactive oxygen species that you get with alcohol, with nicotine as well, right? And with nicotine, it's kind of a dose dependent kind of thing, right? So the longer you smoke and the more you smoke, the more problems you will have. And just as with lung disease, stopping, and then every year after you stop, there's chance for improvement. It's kind of similar.
Okay.
So cannabis now, in terms of STIs, so nicotine may not have the same kind of impact on judgment and inhibition that alcohol and some of the other drugs may have.
Yes.
But there is an association of smoking with changes in immune function and your increased susceptibility to infection in general.
Okay.
And there's one study in particular that found a link between human papillomavirus, HPV 16, so one that is sexually transmitted and associated with cancer, and smoking.
Wow.
And that particular HPV strain is associated with throat and oral cancers.
Oh, okay. So I can see the link now. Okay.
Yeah. So in terms of cannabis now, so there's not that much hard evidence, but there's the problem with cannabis and studying cannabis use is that use is so varied. The strengths that people use is varied, the quantity, the duration. But we do know from animal studies that cannabis impacts reproductive health. So just for people who don't know, your body produces substances that are like cannabis that fit into these receptors called endocannabinoid receptors, right? And you have these receptors for men, you have these receptors found in the testes as well as on like the head of the sperm. The role that they play, I am not entirely sure. We also have these endocannabinoid receptors in the brain, on immune cells, white cells, and in other parts of the body. Okay. And so we know that this whole system, this endocannabinoid system, plays a role in many parts of brain function, immune health, and apparently in reproductive health as well. So like to think theoretically, if you then give yourself an exogenous source of cannabis, you might think you would be disrupting what is normally going on. And we do see that in animal studies. Human studies are not always able to replicate that kind of thing. So what I would say, in animal studies, they find reduced sperm motility, lower plasma testosterone, and decreased LH. Remember that hormone that stimulates testosterone to be made, right? So those are all impacted by cannabis, and it's dose dependent. So the more cannabis they give the animal, the more these things are impacted. There's also a few studies with chronic cannabis users that kind of find similar changes in testosterone, right?
And these are with humans or?
Humans, chronic, yeah, humans who've been using for a long time. What I found very interesting, there was a study in Sweden. It was like a 42-year follow-up study. So they would have followed men who were conscripted into the Swedish army and taken basic parameters and history from them. And they followed them for 42 years. And they found that heavy cannabis users, and they defined that as using cannabis more than 50 times in a lifetime. More than 50 times. So we know how people use cannabis in the Caribbean. So, but they had a higher incidence of testicular cancer in particular. So that was interesting, and I think we need a bit more research to look into that. So I guess the takeaway there is the more you use, the heavier you use, and the
more effects it would have on your body,
the more of a problem it is. Okay, so we're running out of
the information is so rich. I mean,
it's a lot. This is a really huge area. And so let me give a word about stimulants now. So cocaine and that group. So there's not a whole set of evidence on their direct effects on the reproductive organs, but we know that they have effects on the cardiovascular system and on blood vessels. And so you can extrapolate from that, from what I've said before, that would impact sexual function.
Yes.
And then we also know that those drugs are associated with a lot of risky behaviors, and they're very addictive, cocaine in particular. And so with crack cocaine and with IV amphetamine use and methamphetamine use, you have increased risk of HIV and other sexually transmitted infections, right? And it's not just the IV use, it's just the risky behaviors that go along with the substances and the things people do to seek out the substances when they are severely, when they have severe substance.
Yes.
Yeah. So if someone has reproductive problems as a result of substance use, so the very first thing I would say is seek to stop, right? And this can be easier said than done, obviously.
Yes.
So the first port of call is going to your GP, your family physician, and they can refer you to an addictions counselor, to a psychiatrist. They can also refer you to a urologist if there are complications that require that, right? And we have some outpatient drug counseling programs in Barbados. So there's CASA, the Safe Foundation or Verdant House. They also do outpatient counseling. There's Alcoholics Anonymous, Narcotics Anonymous groups as well, right?
Okay. Thanks for sharing that.
Yeah, I do think that is important. If you notice that there are problems with your substance use, it is really getting in the way, seek help. And your family doctor can do a screening questionnaire with you and see how much this is really impacting you and whether this is a disorder, and then refer you for the necessary help. Yeah. That being said, there is some research going on where they're looking at some antioxidants to reverse certain things, but that's ongoing research and people can do their own searching for that. I'm not recommending anyone continue substance use and take any supplements, right?
Yes.
The first thing should be seeking help to stop, right? So overall, how do you maintain good reproductive health? I think this is important. And whenever I talk about mental health, I generally talk about just self-care, taking care of your whole self.
Yes.
And reproductive health being such an important aspect of health, we should be looking to figure out how we can take care of it, right? So good sexual practices. So using barrier contraception, getting regular STI screening with your partner as well. And also reducing the number of partners or practicing monogamy helps.
Yes.
Yeah. Physical exercise is extremely important for reproductive health, because if your cardiovascular health is poor, like what I said before, achieving an erection and having good sexual function is going to be impaired. And we know that physical exercise improves testosterone levels. So if you're getting to that over 30 age, where things are starting to decline, then for sure, exercise is a natural way to increase testosterone. And then you limit harmful substances. So alcohol is legal, but we know there are recommended amounts, right? So like I said, 2 or less drinks per day. And in terms of your heart health, we're finding that even that amount can be harmful for heart health. So limiting substances that are harmful or not starting them at all is one of the best ways to protect your reproductive health. And then in terms of nutrition, a diet that is heart healthy, that supports your good heart health, will help with reproductive function as well, right? So reducing refined sugars, reducing fats, trans fats can be helpful. And psychosocial health, so managing stress in a healthy way, not managing stress with a drink or a smoke, right? But learning ways to cope that are healthy, finding support systems like what we spoke about at the beginning is important. Yes. And then seeking help when you notice problems are there that you're having difficulty coping with. Right, is very important.
Meant to do all these things on your own. You do need a community or a group that can help.
Definitely
help you with it. You know, managing these things can be very challenging, and I think in managing the stress at the beginning is more important than having to find help at the end. So if you can reach out to someone when you have these challenges, that would also be helpful in the long run, you know, because I don't imagine that having to come off of a substance after your body have become so dependent on it is easy for any individual. So I believe that if you can maybe start at the beginning, you know, when you start to feel that stress at work or at home, or, you know, whatever may be pressuring you, just seek out care, you know, before you find something to be dependent on that then has long-term effects on your body, not only physically, but mentally and sexually as well. Yeah, that's very important.
Yeah, definitely. So there, while, you know, emphasis on nutrition, exercise, stress management, and avoiding harmful substances in the first place, or getting help to come off of them, those are like the cornerstones. I did talk a lot about reactive oxygen species and that kind of thing that is caused by toxic substance use, you know, the alcohol, the nicotine. And so supplementing with an antioxidant like vitamin C can be helpful. It's not going to replace good nutrition and exercise, but adding that can be helpful as well. And there's
that as a supplement to the, just as a supplement.
Yeah. So it's not replacing all the foundations of good health. It's helping, especially when we live in an environment where outside of substance use, we are exposed to a lot of environmental toxins, smog in the air, and so on. There's some evidence that zinc supplementation can help with testosterone synthesis as well. But I would say when it comes to any kind of supplementation, talk with your doctor about it first. And I would definitely say, do not go the route of buying any sexual enhancers from anyone or any pharmacy. So many of them have substances that are not helpful, and really go the route of talking to your doctor. And if you do require medication for enhancement, your doctor can prescribe that rather than purchasing from, you know. So, So I guess just some take home points then.
Yes, because you covered so much, and we've covered the effects of it, the uses, all these things that are very, very important. So those takeaway points would give a cap on everything.
Like to wrap everything up. Yeah. So just remember that your reproductive and sexual health is an important aspect of your health and well-being, right? It's not off to the side in a box. Psychoactive substances, whether they're legal or illicit, have negative impacts on male reproductive health, whether they be directly impacting your reproductive organs or indirectly impacting your heart and liver, and therefore then impacting your organs. The best option for improving reproductive health that has been affected by substance use is to find help stopping substance use. Or if you're at very early or mild stages, avoiding progression of that by stopping early, right? And take care of your reproductive health in general and make it part of your overall self-care. So make it part of your routine. So you should want to be doing the things that promote good
health,
reproductive health and good health.
Yes.
So thinking about your nutrition, exercising regularly, safe sexual practices, regular checkups with your doctor, which include prostate checkups, testicular examinations, STI screenings, and helping with stress management, whether it is seeking some counseling so you can learn healthy coping techniques or using self-help tools to cope in a healthy way, right? So I hope that sums it all up.
Yes, it sure does. You have shared a wealth of knowledge. You've been open. You've shared the research that has been out there. So we know that these things do work once you seek the right care. So, there's no need to be afraid to reach out. There are persons that have been there, they've tried it and it has worked. I know you may be thinking that this is a challenge or it's going to be too hard or, but it's worth a try if you want to really be healthy holistically to seek that care. And Dr. Douglin did mention some organizations here in Barbados that do provide that care, but it can first start with your general practitioner. If you are experiencing any of these challenges at all, reach out to your physician and help them, and they can help you to really chart out a path to good sexual and holistic health at the end. So Dr. Douglin, we do thank you for sharing your wealth of knowledge. We hope that we can maybe connect again and maybe look at mindfulness and how it can really impact our lives, maybe in another episode.
Other aspects of men's mental health.
Yes. So thank you yet again, and do have a good afternoon.
Thank you.